Very, very welcome. I'm Lorcan from the Men's Development Network. Some of you might know me from our webinars over the last couple of years, and I'm delighted to welcome you here for this special gathering, which is focused on the preparation for International Men's Health Week, which of course is coming along in June of this year as well. So thanks for joining us here on this very special morning. This year, the week runs from Monday the 10th to the 16th of June. It's never too early to begin preparation for the week, and we believe that here in the Men's Health Forum of Ireland and in the HSE and among the partners as well. And as you know, International Men's Health Week is exactly that, with an all-island focus here in Ireland over the last number of years. And lots of people are involved, and I know that lots of the partners are here on with us today as well. So that's really, really good. We've been preparation mode since, I suppose, back at the end of December 2023. So we've had a number of meetings. So plans for the week are well and truly underway. Now, International Men's Health Week has been very much a part of the Irish landscape over the last number of years. And it's been, I suppose, coordinated and supported by Collie Fowler, he's there in the background, and the Men's Health Forum in Ireland, and many really super partners and team organisations. And as I said, I know that many of you are here with us today. We've over 100 partners plus who are very much part of the symmetry that makes up the National Men's Health Week on the island of Ireland. And I suppose it goes back to what we often say on our webinars here, that we really do believe that when we work together, we are greater than the sum of the parts. And with that in mind, today what we're going to do is we're going to bring you the experience and the ingenuity of some really good people from across our CHO areas in the HSE, who over the last number of years have been working together to make a difference in relation to promoting International Men's Health Week on the island. Now, here's a very important point, folks. Originally, this was supposed to be a more intimate gathering, and maybe some of you are on here today and you thought everybody was going to see everybody on the screen. But because the interest was so great, I think we had 170 booked in here this morning, that we had to go with a slightly different format. So you won't have your camera and you won't have your mic, but you are with us. Believe you're with us. It's a different format that we're working from, and we hope you're going to stay with us as well for that. Now, in a moment, I'm going to pass you over to Finian, and Collie and Fergal, of course, is going to coordinate a lot of the inputs that we're going to have here today. And I suppose before I do that, just to say that if you have any observations, if you have any query, or if you have any question, we do have a questions and answers. So the Q&A is the place to go to. Please bring us anything that you want to ask about, or if you've, say, any observation or maybe an insight, or maybe something even good that really worked for you for Men's Health Week in the past. So we're asking you to really relax. We're delighted you made it here with us. And we hope that what we're about to bring you through the experience of people who've been supporting Men's Health Week on the island will be a support to you as well. So I'm going to invite in my good colleague and friend, Finian Murray, and Finian is going to have a brief word with you here now as well. So go well all and enjoy.
Okay, good morning everyone, and thank you for joining our webinar. And as Lorcan was saying, the HSE have been involved in Men's Health Week from the very beginning. We had our first Men's Health Week celebration here in Ireland in 2005, which was a poster campaign, and the HSE was involved with the Men's Health Forum in Ireland back as far as then. And the HSE has also provided funding towards Men's Health Week every year, including this year for Men's Health Week. And as Lorcan was saying, it was originally, this meeting was originally planned for HSE Health and Wellbeing staff to explore ideas about how we can celebrate Men's Health Week. And then because of the interest, as he was saying, we decided to widen it, open it up, and make it into a full webinar for as many to take part as wanted to. And we have noticed over the last number of years that there has been an increase in activity for Men's Health Week across the HSE family. And that's why we decided to explore this theme a bit more in terms of, what more can we do to celebrate Men's Health Week, which, as you know, it begins on the Monday before Father's Day and finishes on Father's Day every year. So this year it begins on the 10th of June and it finishes up on Father's Day, which is the 16th. So just to give you another flavor of what Men's Health Week is all about, we're going to show you a short video which we have made for the event, and I'm going to get Holly there to cue it up. So I want you to have a look at this video, and this will set the tone. So thanks for listening.
Thank you very much, Finian, and welcome everybody to today's webinar. Really appreciate you taking the time to tune in to us. So we have a couple of great speakers lined up for you, and we'll be all giving them the stage in a minute or two. But I just want to, I guess, just recognize, I guess, you know, that this is the run up to Men's Health Week. We've had a couple of webinars every year in the last few years, and we always try and do one in March or April. So I guess this fits that building in the call out and explanation of Men's Health Week again. There's something in it for everybody. Men's health is a very broad area. I think in terms of my role in the HSE, you know, I'm head of stakeholder engagement and communications for HSE Health and Wellbeing, but I also lead in the area of men's health. And I suppose we're trying to work across a number of policy areas. And what we've seen Men's Health Week enables on an annual basis is it gives loads of agencies the opportunity to engage on their specific topic or with their target group in that you know, that men's space, that boys space. So it's very broad, and I'm encouraged to see the theme of know your numbers, which we'll maybe hear a bit more about later on, and you'll certainly hear more about if you're willing to get involved. Men's Health Week isn't that long away. We always kind of, you know, Lorcan just lived there, that they had their first planning meeting before Christmas. They've had a few planning meetings since, the planning group, and I know some of you may be involved in that. But it moves very quickly, and all of a sudden you find yourself in June, and you know, the 10th of June isn't that far away. So get your thinking caps on now. I'd encourage you to do that, and see see what you can do in your space, in your area, with the men or the boys you want to target and engage for Men's Health Week. So that's really just a call out to everybody. And I think you'll definitely be inspired by some of our speakers today. So you've seen the video. So I suppose Colin, I'm just going to ask you up now to give a little overview of Men's Health Week. And we'll go back into the speakers then. I'll introduce the speakers then in a minute or two. Okay, Colin, thanks.
Thanks very much, Fergal. As I say, Fergal said, my name's Collie Fowler from the Men's Health Forum in Ireland. And one of my roles in the Men's Health Forum is looking after Men's Health Week, which happens every year. So what we hope to do now is just give you a wee insight into what Men's Health Week is and what it does and when it is. But before we start, I suppose just to give you a sense of the Men's Health Forum in Ireland. The Men's Health Forum in Ireland was established in 1999. We work on an all-island basis, and by and large, we're a volunteer-led group. And I'm a member of staff, but I'm the only member of staff. And so with only one member of staff and a long 25-year history, we rely by and large on goodwill, innovation, creativity, and of course, just workarounds. We just have to find practical solutions to the problems that we face. And the work of the forum has a number of different foci. One is awareness raising the kind of issues or shining lights into dark corners, finding the research and the evidence to back up the need for doing something about that, offering training to other organizations, and then piloting some projects just to show that something can work and is possible, and then handing that on to other people. And of course, encouraging people to speak to each other and communicate through networking. And Men's Health Week itself is a really central part of what we do each year in the Men's Health Forum in Ireland. So just, I suppose, a history of the Men's Health Week in Ireland. For those of you who don't know, Men's Health Week was originally developed in America as an idea. Originally, it was to be a Men's Health Month. And way back in 1994, a bill was passed by Congress and signed into law by President Clinton to have a Men's Health Month in America. And then over the time, the rest of the world looked at America and started to get a wee bit jealous. And so way back in 2002, there was a second World Congress on Men's Health in Vienna in Austria. And the people who were there thought, why don't we take this men's health idea of marking it by a week or a month to other parts of the world? And that was the origins, if you like, of Men's Health Week on an international. But in the early days, there was not really anything more than sort of isolated groups doing small things on the island of Ireland. And in 2005, the Men's Health Forum decided to try and bring as many of those groups as possible to celebrate Men's Health Week on an all-island basis. And so I think, as Finian said earlier on, from about sort of, this 2005 onwards, we built our way up from very, very small beginnings to what we have today. And in 2010, we even started then to expand this idea out into a big, big planning group that Lorcan mentioned earlier on. So at the moment, going into Men's Health Week 2024, we have about, over 95, almost 100 active partner organisations who work on an all-island basis. And I suppose just to give you a flavour of what Men's Health Week looks like and has looked like, here you can see a whole lot of different kind of posters from years gone by. And every year there's a particular theme and a particular strapline and a particular message. So what does the forum do in all of this? Well, firstly, I suppose the Men's Health Forum role is to coordinate this all-island planning group. And as anybody who works in groups knows, progress can often be slow, but usually the outcome's much, much better than one person sitting on their own in a room coming up with ideas. We look after the design and the production and the dissemination of the communal promotional materials. And every year we try to research a toolbox for action paper, something which kind of gives you the answers to all the questions you might have about the week. But also people need to know, what can I do to mark this week? And so we also produce another paper that kind of tries to spark ideas among people and see how they can apply it to their own work and living such situations. On the top of this page on the screen, you can see an Action Man manual front cover. And every year we produce a booklet to give out, a free booklet to be given out to men. This is the most recent one, the Action Man 10 Top Tips for Men's Health. And in our work, giving out the book, giving out all the other materials is about creating a public awareness that the week is happening and when it is, and where to find information if you want. So we have a website. But we also try to promote local events and activities. We try to drive people towards what's happening in local communities, and also to signpost people who want to do something about the week to support and information and resources, and of course encouraging people to work together in partnerships. And some of the speakers later on will show how those partnerships have evolved in Ireland. So what does this planning group do? Well, at the end of last year, we got the resources together and we recruited the planning group membership. And most importantly, we had our first planning group meeting where we try to make sure that we've got a common understanding, we've the core value base in place, and we reflect on what we've learned from previous years. From January to March, we hold meetings and polls and different votes on the calls to action and the key messages and what the visuals will look like and the hashtags and the resources. And then as we move towards Men's Health Week, it's about getting those things into the field so that by June 2024, groups who want it have their posters and their postcards and their graphics and their social media messages, and the media is aware that the week happens. So we talked about the theme being every year, and every year we have a different theme. And this year the theme is Know Your Numbers, Men's Health Counts. Now, this is kind of three strands to it. On the one hand, we want government and decision makers and service providers to know the key numbers about men's health on the island of Ireland so that they can do something about it. We want men themselves to know about key numbers related to their health, about their blood pressure and their cholesterol levels and all those other key numbers that men need to know, and anyone in fact needs to know. But we also thirdly want people to know the helpline numbers for support, where you can turn to when something goes wrong. So know your numbers at least 3 different levels. And what does Men's Health Week offer? Well, here's, I suppose, some of the outputs that might be useful to you. There'll be a web page where you find all of the information about the week. There'll be posters in A4 and A3 size, and a smaller version of those as a postcard that can be left around on counters or give out to the men you know, or posted to them even. There's graphics, logos, badges, banners, Facebook and Twitter images, and also sort of promotional materials as branded pens and other giveaways. We try to give some video and audio resources. We try to find people who are prepared to tell their stories and act as ambassadors for the week. But this year, because it's Know Your Numbers, we're also updating the Men's Health and Numbers report cards that we produced in years ago, and also a new set of Z cards with key numbers that men need to know. We try to support local projects and local planning, and this, as I mentioned earlier, to sign people to resources and support. The toolbox for action and the what can I do has already been mentioned, but we spend a lot of our energies on social media. And last year, for example, on the very first day of Men's Health Week itself became in the top 3 trending topics on the island of Ireland for more or less the whole day. So to do that, of course, you need your themes and you need your social media messages and you need the graphics to go with them and the shared hashtags, and those we provide as well. And as well as obviously promoting the events and coordinating the knowledge of those through press releases. The Action Man manual I mentioned earlier will be available free of charge to anyone who would want it. And this year, what we're also working on, along with TUD in Dublin, the Technological University of Dublin, a group of students, young male students, are trying to produce a men's health toolbox phone app for us. And hopefully that will be ready by Men's Health Week. But if not, we will have it on hold for later in the year because it will be a useful resource no matter what time of the year it is. And so I hope that that kind of gives you a flavour of what Men's Health Week is at a factual level, and that the speakers who come next will show you how that rolls out in practice. So thank you very much.
Thank you very much, Colin. That was very comprehensive. So you can see from that presentation just, the history that Lorcan already talked about and Finian mentioned, but Colin has been the driving force in a very kind of really quiet, consistent way to get and amplify Men's Health Week on an annual basis, and really good at the networking piece and then producing all those things with such a broad array of stakeholders. And I want to acknowledge a lot of people on the call already may already be in that army of men's health allies that we're looking to grow on an annual basis. Anyway, now moving on, I guess we want to introduce a couple of speakers, and all the speakers, all the rest of the speakers now are kind of working in health promotion and improvement in the HSE. They've gone, they've put extra effort into the work of Men's Health and Men's Health Week. And we're going to hear a couple of presentations from them. And I've been very kind of inspired and impressed by this work, which has seen kind of a big uplift in recent years. So we'll get going. And the first presenter now is Lawrence Gahan. And Lawrence is the Regional Project Manager in Community Healthcare West. That's Galway, Mayo, Oscommon. He's a Men's Health Engaged facilitator, and he's involved in various men's health programs and activities across the region for a number of years. And he currently coordinates Men's Health Week planning with the HSE in the West. And I'm delighted to have Lawrence here today. And once he came into the area, he was always kind of driving at the men's health area. Once he came into health and wellbeing a couple of years back, and he's really kind of had a huge impression on the West and got his message out. So we'll hand over to you now, Lawrence, if you can share your screen and get the presentation going. Thank you.
Thanks very much, and good morning. Delighted to be here. So as Fergal was saying there, I'm based here in Mayo, and I covered the West, and I'm going to do a short presentation on our last year's Men's Health Week in particular. So just trying to share there. Not sure if I have a technical glitch there or not. Maybe Collie might have my my slides. What will I just see here now? Yeah, there we go. Yeah, thank you. So Just I suppose by context, last year I suppose was the first year we kind of had a more integrated and planned approach to Men's Health Week here in the West. Myself and my colleagues, we were always involved somewhat in Men's Health Week, and we always had a focus, I suppose, on maybe having one or two large physical events. But this time last year, then I was talking to Collie, and he was telling me about a lot of the approach in Northern Ireland, where it was a more gradual, I suppose, and a more community-based approach. So then we began then this time last year, roughly in March, and we began planning then for Men's Health Week. And in our next slide there, we kind of have an outline of the process and the organizations involved. Yeah, so essentially, the whole emphasis here was on developing partnership, and we had approximately 50 organizations. So from say March last year, myself and some colleagues, we started to develop a list of partners, and as you can see there, we had a large array of partners, approximately 50 across the region then, and that was a lot of organizations in the statutory, semi-statutory, voluntary, community sporting organizations. I might mention some of the more significant partners probably were associated with the county councils, the Healthy Ireland coordinators, CRE, the West of Ireland Stroke and Heart and Stroke Charity. We had people from the leader companies, the Men's Sheds. We had healthy libraries, local radio stations, sporting organizations, and we also then had people who participated in the Engage training. So over the previous year or two, we had maybe 50 or 100 people that actually undertook Engage training, and they became great advocates and our partners. So then after that, then we started our county planning meetings then. And on our next slide there, we have an outline of the process generally. So as Fergal was saying there, it might appear early starting now, but we've already started for this year in March. So we started planning meetings, then that developed on a county basis, and we gradually grew the number of partners. So we might have started off with 10, 15 partners, and that gradually grew then as the weeks went on. And we had meetings then, say, every 3 weeks or so. We had planning meetings, and we also then developed county calendars. So we worked on a county basis. So we had a focus on Galway, focus on Mayo, focus on Roscommon. Then we developed the list of partners that led into calendars, which I'll show in a moment. And then we also focused on a county-based approach, as I say, focusing on county marketing in terms of county graphics, county calendars, and then a focus on local personalities as well. So we had a lot of GEA and other personalities involved at county level. And that all grew then, I suppose, into a planning mechanism. And we also then had close liaison with our own HSE local communications, particularly leading up to the weeks in terms of social media and getting our messaging out. So on the next slides, then I'm going to show here to give a flavour just of the calendar of events. So as I was saying, gradually, say by May, we had this calendar of events developed by county. And here you can see the array of partners and the array of events that developed. So some were very small and some were large events. So as you can see there, we had events in family resource centres and libraries, local marts, local halls, community centres, sports clubs, boxing clubs. There you can see jumpers for goalposts and classes and taster events, and we also had a photography competition then attached to the month as well. So that was just a flavour. Then the men's sheds throughout the region came on board, and most of them had an open morning during a particular day during the week there. So on the Tuesday, most of the sheds were open between 10 and 12, and that was a recruitment event as well for the sheds. So that was a quick overview there of the things. Then as well, we also had a landing site. Then we have a particular site here called Westby Well, which is a local site here that a lot of our resources are based on. It's primarily a mental health and wellbeing website, but we use that website as our landing site. So all of our resources and calendars and messaging and all that. So when we were using local radio or messaging, we were able to drive the public to this single website for information. And on the next slides, then you can see that's the Mayo version then. So the first one was Galway. Again, we're using the county colours for people that aren't familiar. Mayo colour might be fairly well known, but so we're using the county colours there. And again, a similar array of events there, you know, from bowling to men's mornings to marts to blood pressure checks, where another big emphasis, as I say, CRE, the Stroke and Heart Foundation were on board, and then we had a lot of health screening going on, as I say, in say farm stores and in marts, and then we had the walking football and again the picture of health. And similar then the last one in Roscommon, there is a similar slide again using the Roscommon country colours again, and a similar array of events again with similar partners, and you know, some days, some evenings. So that was gradually built up, as I say, and some of those events might have been large, you know. We had a few flagship events, as it were, in Galway City. We had a particularly large event on the early in the week, which was attended by maybe 200 men, which was led by the Galway City Council. And I might say as well that the involvement of the local authorities and the Healthy Ireland coordinators was key, and the libraries and those statutory agencies was key to the success of the week. So just moving on then, here we have an array of some of the capturing the events, the champions and the promotion associated with the week before and afterwards. We were very successful to have a lot of GEA personalities there. We've the Galway hurlers and Henry Shefflin, and that was a flavour there of the Galway events. You can see as well, we've taken the county colours, the marketing through then at a county level in terms of the county graphics, again, to localise the county colours and the graphics there. So there's 4 or 5 slides there now. We might just move through them. That's the Galway City event then. That was called the one I mentioned there. It's quite a large event in Galway City Centre, and we're building on that again this year. We're already in planning, and it's been organised already for Monday the 10th. So that's going to be a big event this year, and it was quite large, as I say, as well, about 200 men, with a particular focus on homeless men. And on the next slide, you can see, I think there we had a barber and musicians, and it was quite a fun activity event. So that was quite a unique event with some of the Simon community and some of the other community and homeless charities. On the next slide then, that's just some of the images there from the Mayo week, and we had local radio. We have some GA personalities there, the Mayo, some Mayo TDs, Mayo GA personalities, Mayo managers, and so on. So that was again the county colour and the emphasising the county brand as well. And moving on then to Roscommon, it was a similar theme there again with the Roscommon colours, and the similar themes from, you know, golf clubs to resource centres to health checks and community events. So that's a quick flavour of the activities. And on the last slide then there, I think this is an infographic then which captures the week at a glance here in the West, in Mayo, Galway and Roscommon, and that's just a graphical representation. You can see there approximately 80 events then held during the week, and it gives an array, a selection there then of the array of events that I've mentioned, you know, from walking football to health checks to health fairs to jumpers for goalposts to men's health checks and taster events and talks and so on. And then we had, it gives a flavour of the array of partners from the private sector, the sports sector, the statutory, and the community and voluntary sector. And then our media coverage was quite good. We also had key advertising then throughout the week on Mayo Radio and Galway Bay FM, they're the local radio stations. We also had engagement with the local media. And then we had a selection of interviews, so key topics and key people on 3 or 4 days of the week going out on local radio, whether it's physical health, mental health, with the Irish Cancer Society and other key messaging. So we're hoping to build on that again this year, and that's already well underway. And just then yeah, so that's the last slide there. So just that gives a flavour then of the the social media activity as well, and the health checks and so on. So just a quick reflection, I suppose, on the week then. Some of the key learning was, one, I suppose we had to start in time. We couldn't have started too early. Probably March is really, it needs to be. We've already, as I say, started planning for next year. The other thing is partners, of course, and to build up the array of partners that's needed. And then thirdly, I suppose, is engagement, of course, trying to engage with as many organizations and partners as I've mentioned. And in terms of the week itself, then trying to manage all of the social media. And this year we're hoping to build on that, to have greater management of the social media side and greater coordination, and possibly to employ somebody to work with us on the media side in terms of managing all of the messaging. So I was surprised as well, I suppose, when I started. I didn't know really what volume of activity we'd have, and I was really surprised at the level of engagement and the wonderful participation and involvement and the commitment of all of the partners. So that's it really in a summary, Fergal, I think. Thank you.
Thank you very, very much, Lawrence. That was very, very good. It's such an array of stakeholders. It's unbelievable in some ways. The amount of, I remember talking about this with Finian after we saw what you did. And I was saying to Finian, did you see what Lawrence did? Like, you nearly replicated the work that the Men's Health Forum were convening, that network. You created your own West network, and you just, that slide there with all those agencies. It kind of hit even home stronger to me when I was seeing images of Ballina and Mayo, from where I'm from, and seeing people that I knew that you pulled out of Barbers and all these other places and the golf clubs. There was no limit on your kind of scope, and that was great. You were really open-minded about your, the people that your allies, basically. You kind of opened the door, and so many people came in.
Yeah, there was great goodwill, Fergal, though. As I say, maybe when I started in March, as I say, I think we'd 10 maybe we'd had online meetings, and maybe we'd 10 at the first meeting, but gradually grew to 20 and maybe 30, and people kept coming back as well. And I think as well, there was an element of competition almost emerging, that if there's something in Ballina, then we better do something in Ballinrobe, or we don't want to be left out, so there was an element of that as well, and people quickly latched on. And I think the idea of small events as well, doesn't need to be anything dramatic, it can be as simple as a coffee morning, or as a walk and talk, or some little event. It doesn't have to be dramatic events, so I think that the goodwill is certainly out there. If we can harness it,
Yeah, no, I think you're giving us all some food for thought about the scope of partners, and even the smart approach about your branding and integrating that kind of county theme. I think that was very smart. We often talk about, when we're planning things in the HSE, we've different regions or different areas, and it can be a challenge sometimes to speak across areas, and different agencies have different regional remits. But given the county badge, it really hits home to people in that county. And then seeing the people, like, as you said there, you have the Mayo footballers and you have the Galway hurlers, and people like, everybody knows them, and getting onto the local radio and in the local media. I think you've done a great job, and I'd like to compliment you and your network, your support team in health promotion, and also local comms that backed you up there on that. That's very important as well, I think.
Yeah, thanks, Fergal. Yeah, and I think local radio is really powerful. Yeah, in rural areas, it's really powerful communication tool. Yeah.
It is. Yeah. So we have a question there for Lawrence. Any partners you worked with to support men around intellectual disability?
Well, we had some. I know the Brothers of Charity in Galway, I know, and I think we may have had some of the education training board as well, with somebody from the education side and the training centres. I recall some of those. Yeah, I think there was a few smaller events. Yeah, it's probably a bit of a challenge there, but we certainly had some partnership there, I think. Yeah, in Galway in particular. Yeah.
Okay. So Lawrence, if there's any other questions, you can come in on the Q&A, and if we don't get to them after the next speaker, we'll round them up at the end. I'm going to say goodbye to Lawrence for now, and bring on our next speaker. Thanks very much, Lawrence, again.
Okay.
So our next two speakers are Dan Russell and Corrick Brazil. Dan has been working as a health promotion officer in the HSE for almost 2.5 years. He works on the stakeholder engagement communications team. He's a big physical activity promotion man. And in CHO7, he links to sports partnerships in Kildare, South Dublin, and Dublin City. He's also very involved with Park Run and promoting that. Before that, he was involved in sports development work and physical activity work in Dublin City, like Operation Transformation, Active School Week, Couch to 5K, and Sports Inclusion Week. Porrick Brazil has been a health promotion officer in the HSE since 2021. He's a keen interest in the area of men's health for many years, and is currently an area of special interest within his work. He's a men's health engaged facilitator and recently worked alongside the colleagues in CHO7 and CHO9 to develop the Wellbeing for Men program. That was an adaptation of the kind of positive mental health mind and your wellbeing program, and he's worked on the development of that, targeting men specifically. So that's a great initiative. So the two of them are here now. They're on, and I'll pass them over to you. Thanks a million for coming on today.
Thanks, Fergal. So guys, I'm Dan Russell. I'm going to be the first person to speak today. And we've been very specific about what we're going to present on today. One is around Men's Health Week in 2022 and our partner with Parkrun. And then in 2023, we, I suppose, there was a number of Sláinte Care Healthy Community sites launched in CHO7 in 22 and 23. And it created a lot of goodwill with a lot of partners. And when we formed a working group, we realised that there was scope to maybe have some kind of a men's health open day or a men's health check day. And Porrick will go into a little bit more detail about that. But I'll talk about our Parkrun event first of all. Now we need another slide. Yeah. Okay. So in 2022, we had some local success with an older adults Parkrun walking event. And we very quickly realised that the 3 park runs in the Kildare area of Castletown, Naas and Kilcock, had a super group of volunteers and were very willing, to help with health promotion events. And then the National Parkrun Office, in particular Matt Shields, was also very supportive of a previous event with older adults. We kind of scoped out and put our heads together and got a working group together to figure out, could we actually run a Dads and Lads event or a men's health walk as part of Men's Health Week in June 2022. If you just move on one more, Porrick. Sorry guys, Porrick is sharing the slides. I can't share them here for some reason. And what we realised was that, there was a very willing group of health promotion officers in Kildare, and there was a very, very willing group of other partners as well in the Kildare area who wanted to come forward and wanted to help, make this happen. So what we did was we devised a very small social media campaign, and then we used local partners in the Kildare area and Parkrun partners, to promote a one-day event. So for one of the Saturdays in June during Men's Health Week, as an event for new men and new boys to come along and register as volunteers or register to walk and register to run. And we weren't really sure, exactly what the outcomes were going to be, or, so what we decided to do was to also ask the Parkrun National Office, if they could actually, provide us with some kind of really solid metrics, after this event. And what we found was that the actual lead into the event, was quite a simple process, because the park runs have such, a good group of volunteers, and they have such a good administration procedure. But what I was more concerned with after the events was, how many new men came along or how many new boys came along, and what we looked at measuring was, who registered for the first time in any of these 3 park runs, okay? Who became a volunteer for the first time in any of these 3 park runs, and who actually ran or walked for the first time in any of these 3 park runs. Okay, if you go on to the next slide, Pádraig, and what you can see is that the Park Run National Office were very good at coming up with the metrics of what happened at each event on the day. And they were actually very good at showing us, you know, what can happen as a region or even at a national level. If you go to the next slide. Okay, I'm not going to go into all the metrics at the moment and continue on again. But it was very easy to figure out, you know, the success or failure of this event. And what the overall results actually showed us was that there was a small increase, you know, somewhere less than 5% on the numbers of men who actually registered to become new participants on the park run that day. And there was a smaller number of men, somewhere in and around 1 to 2%, who registered as volunteers on the day. But the learning was in the process, that this can be replicated and it can be duplicated. So what we're hoping to do this year is to actually, you know, have some kind of a communications campaign with Park Run and with all our other partners across all the events in CHO7, and try and get more men to come forward as volunteers, as walkers, and as runners at Park Run events. And I'll go into it a little bit more at the end of the presentation, but I just wanted to give an overview of, I suppose, the metrics and how it can be expanded. Over to you, Pádraig.
Yeah, thanks very much, Dan. So as Dan said, then this year, or in 2023, sorry, last year, we had a couple of events in our CHO then, and kind of the main event then was a men's health check. So we ran it in the square in Tala in partnership with a lot of outside partners. So we had people like the Irish Heart Foundation, we had the Marie Keaton Foundation, and we also had the Pharmacy Hub then as well. So what we done is we obviously had our campaign to advertise it there. You can see our poster that we had ever, and then also the letter that was sent around to external partners as well. So on the day then we tested things like blood pressure, BMI, blood glucose, carbon monoxide testing. We also had a smoothie bite there, and we had nutritional advice and also exercise advice. As you can see, there's no appointment needed. And again, a lot of the people that we had attending was footfall from people in the shopping centre on the day. So in terms of the planning then, we probably haven't as many partnerships as some of the other groups. Again, we had a lot of partners involved, but we also had a lot of team members from our own team involved. So it's myself and Dan who spearheaded it. But again, we drew on the expertise of our kind of wider health promotion team as well. The idea of drawing from the wider kind of group was that myself or Dan wouldn't have great knowledge of the Tala area. So again, it's drawn on those local partners and people working in that hub or that area who'll be able to contact with the local, like the local pharmacy who we got involved, and other local staff from the area then as well. So you can kind of see there, this was kind of our checklist for the event. This was a massive document that we had in terms of roles that we all had, or kind of jobs that we all had on the day or building up to the day, and then also in the follow-up then as well. So as I said, we had lots of health promotion staff. Again, we all had different various expertise, from recruitment of people, kind of getting people engaged on the day or getting them in to the health checks, to also then evaluations following the day as well. So you can see there just from, so as I said, we've had an evaluation on the day as well. So kind of from observation, it was around 120 people attended on the day for that day. And then we've had a breakdown then, obviously male and female. So we did have some females as well. So the scenes helps men receiving health checks. So then they came in for their health checks as well. And obviously we weren't going to refuse anybody on the day. And then if you look at the age profile of it then as well, we've done a breakdown of the age profile, how they heard about the men's health fair. And then we also kind of done a follow-up after then when people had their health check done. There's kind of a small sample size of people choosing at random just to create, or just to complete a short survey of their experience overall of the day. So there we have people from our local pharmacy. And that's kind of the message we want to get across today as well, that by getting the pharmacies on board, it really lessened the workload for us, but it also had a bigger impact then on the day, because they provided a lot of stuff that we weren't able to provide. So they were to provide all the testing, the blood pressure testing, the glucose testing. And it's a really good idea that locally, if you were planning a health event like this, to get the pharmacies on board. And maybe that's something nationally that the HSE and pharmacies to look at, is maybe getting the pharmacy hub on board. And again, to link in with local HSE staff that can carry out these checks then in their area as well. So again, and then there's some of the more important stats come from then as well. So as encouraging this health fair, how do you think about changing lifestyle habits, such as smoking or healthy eating? Again, almost 80% of people said that it had changed their opinion of this, or it had kind of put them on the right track to change a health behavior. And then also overall, it met the expectations of everybody. And then, as I said, the second important stat come from today then is that almost 3/4 of people said that attending the health fair has encouraged them to see a GP. So if there was high blood pressure or glucose, or their BMI was a little bit high, that almost 3/3 of them, it had encouraged them to go see their doctor as a result of this. So that's a little bit more about our health fair on the day, or our health checks on the day. I'll pass it back to Dan then, just to summarize our piece then.
Thanks, Pádraig. Guys, sorry, I actually missed out on one important piece of information just at the very, very start of the presentation. And that was just a little bit around parkrun. You know, we've got around 127 parkrun sites in Ireland. And there's been huge research through the UK and Ireland around the benefits of parkrun. And I actually meant to read out these stats beforehand. And like 83% of all participants who take part in parkrun say it gives them positive mental health. 91% of all participants who take part in parkrun say that it improves their physical health. 85% of all participants involved in parkrun, whether as a volunteer, a walker, or a runner, say it improves their happiness. And 92% of all people who take part in parkrun say they feel like they've some sense of personal achievement. And this research is carried out by Sheffield Halal University, you know, which is one of the leading universities around for kind of physical activity research. And I apologise, I meant to say that at the start of the presentation, as that's one of the reasons why we selected parkrun as being a partner for Men's Health Week. So a couple of key learnings that we've made over the last 2 years, because myself and Pádraig are quite new to the HSE. And the more HSE and the more health promotion staff that are involved in these events, you know, the better they seem to work out, and particularly staff with local knowledge. And the health fair event, which happened in the square in Tallaght, I think 6 of the health promotion team were either living in the Tallaght-Clondalkin area, from the Tallaght-Clondalkin area, or working in the Tallaght-Clondalkin area, and involved in Sláintecare Healthy Communities, which was a great help. And then the variety of experience that we had in the team. So someone from a nursing background, a sports science background, a community development background, and a counselling background also provided to be a great asset to us. Can't emphasise enough the pharmacy hub in Tallaght, and there was a couple of photographs there of Michelle and her staff. They were absolutely amazing on the day, and they went through a minimum of 140 kind of glucose sticks for measuring blood sugar levels, and you know, the resources they put in, they brought their own equipment, they brought their own signage. They had 4 staff present on the day. I just think it will be an amazing partnership, you know, if there could be some kind of a form of recognition between the Men's Health Forum and maybe HSE Health and Wellbeing, that during Men's Health Week, that there would be some kind of formal national recognition, if it's possible. Going back to the parkrun events, parkrun have great Facebook pages, they have great Twitter channels, and they have great community connections. And I think what we're going to try and do this year is partner up with all the different parkrun events throughout CHO7 and make maximum usage of their really good profiles in the community. And they've actually appointed a national communications officer recently. His name is James, and we've already met with James. to see, can he help promote a men's health walk event during Men's Health Week. Onto the Men's Health Forum themselves. The assets that they provide, the printed assets, the digital assets they provide are absolutely, top quality. And we found them to be a huge help in the last 2 years. And I have to give the Healthy Ireland team a mention as well, because we've brought some of their merchandise out to the events, and they're a great icebreaker, and they're a great way to talk to people, maybe after the park run or before or after the health check event. And they really do work, so having a look at, maybe having a national store for merchandise or regional stores for merchandise going forward could be an idea. And then the last thing, particularly with the men's health checks, is we took 2 approaches to communicating this event. One was a very targeted approach, which was with the likes of the men's sheds, the heads up groups with South Dublin Partnership and the mental health services, Eve services or Eve Holdings, the social prescribers, and then some of the more targeted populations working with South Dublin Local Sports Partnership. But we also took a very general, completely generic public approach as well, where we just had normal social media campaigns, and we sent out a letter of invite to all the primary care teams and all the primary care partners. And I think that led to the really, really high footfall, which could have actually been closer to 180 people on the day. The other thing I'll say to finish off, I'm not sure Pádraig mentioned it, but we got about 25% of our participants were women on the men's health check, who were not going anywhere, until they received the exact same checks that the men did. And even after the park run event in 2022, if you go back through the slides, you'll see I have some photographs of females there as well. We probably had more females at the 3 events in Naas, Castletown and Kilcock who wanted to take away, assets and information for husbands or boyfriends or sons and fathers. So they're not to be forgotten about as well, at any of these events. Thanks very much for listening, guys.
Thanks very much, Dan and Pádraig. Really interesting stuff, and it's great, I guess, just like Lawrence was doing, you're trying to attach metrics and measure to your work, showing insights into your planning. And as you said there, you're learning from your efforts in terms of planning again for this year. Again, you're utilizing existing networks, and you're literally making new networks, and you're calling us all out in terms of some of the opportunities that are there, the likes of the pharmacies and other partners. It's great when there's an ongoing event like Park Run. I think Park Run, we can never promote that enough, because people do need that nudge. And once you get hooked, people seem to really love that kind of Saturday morning outlet. And it's pro-social. It's not competitive. It's really user friendly, I guess, isn't it, Dan?
Yeah, I just only last, not Saturday gone, the Saturday beforehand, the social prescribing teams that are based across the 4 Sláintecare Healthy Community sites came together, and they held a social prescribing park run event in Cork Park. At the same day, purely by coincidence, we were also having some of the men from the International Protection Applicant System up in City West, and we had about 35, of the lads from there attended that event as well. Our colleague Denise Croak has developed a really strong communications process with James in Park Run, and I think we have 11 different events planned for 2024. And they're very willing partners, and they're super friendly, and and it's for everybody. It really is for everybody.
Yeah. Thank you very much. If there's any questions or comments, please put them in there, just to call out to the rest of the participants there. What else did I want to say about that? Just to commend you both on it, and I think there's lots of learning there for both practitioners in the health and wellbeing space, and as Lawrence said as well, it doesn't have to be big. You're showing real insights into the kind of the planning, and the delivery and the output, the networking and the communications, all the elements to a health promotion activity. But as Lauren said, you know, big things and small things, they all kind of help. So there's so much opportunity there. So I'll let you go there, lads, unless there's any questions there. So thanks very much again, and the best of luck to you in your planning for 2024. So next up is Claire Deasy. I think we have a video as well. Colin, you might tee up that video. Claire is based in Cork and works in CHO4. She has 20 years experience of working in health promotion, both here and in the UK, in the areas of nutrition, physical activity, smoking cessation, and men's health. She's also been a facilitator on the Engage Men's Health Training Program since 2018, and they've won a recognition award for their work in relation to men's health, and we play a video from that now.
Number 50, number 60, number 70, 3 number 70, 83, number 80, 93, number 94.
In South Kerry, we would have a large population of men living in rural isolated areas. As part of Men's Health Awareness Week back in June, we organised 2 health awareness days, one in Kenmare Mart and the other in Ivra Mart in Carsavine. And we also linked up with the pharmacies in Kenmare, Carsavine, Sneem and Waterfall, where they did free health checks for men all that week. The atmosphere was just electric. It really, really was. I suppose Bernie, who is the Mart manager in Ivra Mart, said she'd never seen such a crowd at the Mart for years. So there was real connection there, and I suppose it really highlighted the need for connection to improve our own health and well-being as well.
I was very happy with the turnout on the both days. It was great to see men from farming backgrounds and working backgrounds attend the 2 days. They were very positive. They were engaging with all the stalls at the activity. There was real interest. It did surprise us a small bit with the turnout, but I think times are changing with men. They are becoming more aware now of minding their health.
The project was so well run and well organised that they decided to bring a health for men, local men, and it was well attended and it was very casual. There was no pressure on anyone to do anything or say anything, and the people that were running it were so intense in what they'd done and done it so well that everyone got a great vibe from it. Well, the Mart is a very important place for these people because their outlet for the week. They come to the Mart every Monday and every Thursday, and they feel at home. The Mart is part of their home life as well.
I'm extremely proud of this event, I suppose. For us in health promotion, it was thinking outside the box. It was working with really unique setting as well as working with the Marts, both in Kenmare and the Mart in Carsavine.
So Claire, you're good to go there. That's a beautiful video for that recognition award you got.
Yeah,
well done. I'll leave it over to you now to do your presentation. Thanks very much.
Thanks, Fergal. And I suppose, look, just to say, Michelle Foley, I suppose, who's the person who, you know, it was the real champion and driving force around bringing that to fruition. She was unfortunately not able to join us today, but I think you got a great sense from the video of what they've achieved down in Kerry. And I suppose it's the plan for 2024 is to grow that, and they're going to Milltown Mart this year. So, you know, in the space of 12 months, that will be 3 significant, I suppose, populations in the south of Kerry that will be reached through the initiative. You could see there was, Michelle mentioned connection, and I think connection is such a powerful word. No matter what kind of health you're discussing or any population you're discussing, but I think with respect to men's health, you know, it's really important for us as professionals who are trying to support men to improve their health and well-being, that we connect with, you know, all the partners, that we connect, you know, with the evidence, and we connect, say, with the brilliant resources and supports that are out there to maybe support us to do work for Men's Health Week. So I suppose I will speak a little bit more about the Men's Health at the Mart afterwards, but I suppose I'm going to kind of take you through maybe our process here. So how we've kind of approached it from a CHO perspective, but also how we've approached it from, in particular, a health promotion and improvement perspective. So I suppose I actually sit on that national planning group that Fergal and Collie would have mentioned earlier. So we always start kind of planning for the following June, alongside the timeline of that planning group. So whenever we get that date for that planning, that first planning meeting for the following year's Men's Health Week, that's when I start kind of pulling together people in the department and start mooting around what are we going to do for Men's Health Week next year. So we're very fortunate here in CHO4. We have a really dynamic CSE team, so that's the communications and stakeholder engagement team, and every year they're totally on board with, they highlight Men's Health Week as a key campaign that they want to support, and we have a fantastic kind of working relationship with the wider Cork Kerry Community Healthcare communications team. So we start kind of, we start putting together, I suppose, a timelines template about what we want to achieve, between kind of early January up to, I suppose, Men's Health Week and then after. So I suppose in terms of broadening it out to the department then within our colleagues, we would have had a first planning meeting in kind of later January, early February. And I'm kind of going to talk you through how we kind of approached that kind of meeting. And then a bit like what Lawrence and I think what Dan and Porrick were saying, I suppose the seeds of kind of potential projects start kind of fermenting there in kind of January and February, but it's the real work kind of starts from about March, April onwards, and particularly then from early May up to Men's Health Week, it's real campaign focused, and I'll talk a little bit later about what I mean by the campaign side of things as well. So I suppose we decided to approach it, a bit like Lawrence in the West did a kind of a county approach. We've got 14 community health networks here in Cork and Kerry Community Healthcare. So we have a health promotion officer attached to most of those networks. So we've decided to go with a network-based approach. Also, we're really fortunate, and I think it was Dan and Porrick mentioned like the skills of the wider health promotion department. We bring everybody in, and I think that's really important. We have a team of dietitians here that they've hosted some fabulous things around men's health, and in particular that they do a webinar every year called Food Fit for Men, and it's a great opportunity to kind of, I suppose, widen, bring in other people with other skills within the department, that it's not just seen as the project of one person, or that it's connecting into people's existing work plans as well. So we also have, I suppose, linking with the physical activity team, we link in with our smoking cessation specialist. We have very recently, a cancer prevention officer started with us, and we also, of course, the brief of staff health and sexual health. So our approach was really to do things at a network level, but also bring in these kind of existing work streams that we have, and how could we embed those into the Men's Health Week as well. So I suppose when we were coming together to meet as a department, I suppose we adopted this kind of, what can we do that will have an impact? And I suppose we looked at it like a traffic light, because I think
Sorry, Claire, your presentation isn't sharing there. Are you hitting share?
Oh, sorry.
No.
Okay. Yeah, sorry. Has it shared at all? Apologies.
No, we just saw the slides, but we didn't see the first slide. We didn't see.
Okay, sorry, apologies.
Here we go. That's it now.
Yeah.
You're on
okay. Now. Well, look, I don't think there's anything there. I suppose, look, just you didn't see that slide either. So look, I think it's kind of self-explanatory, so I do apologize for that. So I suppose when we met, we kind of adopted a traffic lights approach because we felt, you know, a bit like what Lawrence and what other people have said in the call, you know, it doesn't have to be the big thing, but sometimes there's pressure on people to, I need to go all out and plan a major event. You know, I don't have capacity to do that. So we kind of, here in the department, we kind of came up with this idea of green is what everybody should be able to do and we expect people to do, and amber is what people may, you know, hope to achieve. And then I suppose the red light is the thing that stops us all. It's that thing about capacity and just other work conflicting with it. So I suppose as a green light, as a basic kind of thing that we can all do, I feel, you know, be it within health promotion or even in other organizations, it's about reaching out to contacts. So your existing networks and your existing contacts and asking if they have anything planned or they think of planning anything for Men's Health Week. And I suppose depending what comes back, you know, it's opening that discussion up. And I suppose depending what comes up back, you either offer to support it, either in terms of, you know, planning it, you know, doing something at it, or you offer to promote it and signpost it. The next thing we did was just you email it all in your contacts and raising awareness of the week, and I suppose signposting to the materials when available. So I think, you know, a little bit like what the other speakers have done, you know, we would have just, you know, drafted a kind of a consistent kind of email, and we would have sent out, you know, the really good resources, say through the Men's Health Forum. So this idea of this, I think it's about a 12-page PDF. What can I do to mark this week? And we would have sent that out to, you know, people, you know, again, at a network kind of level. You know, people have very specific and individual contacts. So it makes things more intimate, you know, rather than seeing something in a broader broadcast, the more likely to return the email to the person and say, look, I'd love to talk about this and see what could we do. And then we would have also kind of disseminated information like the Action Man manuals and the posters and things like that. And I like a simple aim even to ensure that all the primary care centres have a stock of the Action Man manuals, you know, in their waiting room, or to have the posters up for highlighting Men's Health Week, even to ensure that there's consistency across the networks. We felt that that in itself is supporting, you know, one of the aims of Men's Health Week, which is to kind of shine a light on men, you know. Then I suppose we felt that that was achieved, that's something that's achievable for all, and that's what we would have done last year, and that's what we are doing this year, kind of as we speak. We're kind of in that mode at the moment. Something else we felt that we could do, and I suppose again it all depended on where people are at within their network with regards, I suppose different networks are more established than others, and I would imagine that that is quite similar for across the country. But you know, a presentation to network staff around what supports there are in terms of men's health, in particular from the HSE. So a presentation on the likes of Engage training or the Minding Your Wellbeing for Men and other supports like that. We have a fantastic network. I think we're nearly hitting 100 Wellness at Work committees here in CHO4 across all the sites. And that's a really ripe opportunity. You know, these are local champions within HSE sites that are there to kind of do things, keep staff health, you know, on the forefront on the agenda. And I suppose they've been supported by this department, a lot of them, in terms of access to training, access to resources, but also access to funding. So I suppose there is, you know, network health promotion officers, as well as I suppose staff health and wellbeing health promotion officers, have really good relationships with a lot of their Wellness at Work committees. So I suppose it's about linking in with those and kind of, again, highlighting that the week is coming up and giving them a flavour of what they could possibly do in terms of, you know, activities for their men. But it's even asking the question, is there a man on the Wellness at Work committee? You know, is there representation in terms of what do men want in terms of staff health and wellbeing? So that's something, and I think we are looking at doing potentially an information session for Wellness at Work committees, potentially around Men's Health Week, and again, just giving them ideas of what kind of things they could do as part of the week to just highlight men during that week. And then the kind of last thing is, I suppose, that capacity dependent local initiative. And I suppose the local initiative is very, very dependent on the landscape in terms of the, you know, the types of men, the demographic of the men in the local network, but also I suppose in terms of the partnerships and the stakeholders that we have access to. And I suppose the red light, that's the things that unfortunately stops a lot of us. But I think it's important to be mindful of our capacity. And I think when we're planning for something as a campaign, you can feel pressure to have this really large scale event that could take a lot of work and time. But actually, if there's small bits done by a lot of people, can actually be equally as effective, you know. So I suppose examples of the local initiatives that we have explored, and I suppose some of them we actually have, I suppose, delivered on as well. So we've seen the video there from Michelle down in South Kerry about the farmers' health at the Mart. And like that's a huge commitment. And I suppose, you know, that would have come about after months of planning. You know, there's but I suppose what came, you know, it didn't come from nothing. It came from, you know, having a really good connections in the community to begin with. So I think prior to before the Men's Health at the Mart was even conceived, Michelle was already on the ground making those connections with the likes of the South Kerry Development Partnership, you know, the likes of he spoke in the video there, the rural men's work development worker, DJ, and I suppose other people like DJ who really had the access to the men and knew what the needs and I suppose what the problems associated with kind of engaging men in those areas. So already before the notion of the Marts was conceived, there was already, I suppose, an element of partnership working there already. But I suppose a lot of work went into it last year, and you know, Michelle certainly was a driving force behind it. But what we are left on with, I suppose, you know, 18 months onwards, is that the momentum is there, and the group have become really strong and really kind of solid. There's a really strong foundation there now for that to grow. And I suppose as such, the workload to a degree, you know, stabilizes or decreases for any one person, because there's so many learnings from the first run of it. So, you know, the model is only going to have minor tweaks for Milltown now this year again, and the tweaks are all to do with kind of local issues, etc., etc. So I suppose one of the other things that we're hoping to do as part of Men's Health Week is deliver Minding Your Wellbeing for Men. So I think Pádraig, he was one of the people responsible for bringing that to kind of fruition. And again, you know, that would be targeted maybe at our staff here in the HSC. And again, in terms of staff health and wellbeing, that's, you know, part of our commitment. It's really, really important. We've looked at exploring men's health at the Barber. So we actually haven't done that yet, but it's something we're going to maybe explore in tandem with the pharmacies. So last year we did both in South Kerry and West Cork, you know, and as has kind of been shown by the other two presenters, the pharmacies, look, there's a pharmacy in every village and every town, you know, that is where people go. If people go to the shop, they used to go to the post office, you know, the pharmacy was the next place we're going to. Even men who may not be minding their health, they still probably go to the pharmacy. It's, you know, it's not not as daunting a place perhaps attending a hospital or attending a GP or a primary care centre, because it feels more like part of the community and a shop front. So in terms of kind of making it I suppose a very low stress kind of opportunity to bring men in the doors to kind of start a conversation around their health, we found that, I suppose, the pharmacies that we engage with down in West Cork and in Kerry, they were just, you know, superbly on board, and you know, it was very chilled, very relaxed. They, you know, that obviously planning it, you know, it requires, you know, linking with them a decent timeline in advance, because they would have to ensure that they've staff available. So I suppose in West Cork, for example, they committed certain hours of certain days of the week when they knew they wouldn't be as busy, that they could free up staff. So I suppose if you are thinking of approaching pharmacies, that's something to just bear in mind. You might have to like literally physically knock on the door of the pharmacies, or you could get in touch with the chain to to kind of see if they have any plan for Men's Health Week themselves. So I suppose in terms of the other kind of things, in terms of the local initiatives, and this is where a lot of the kind of work that happened last year is when people reached out to those people, to those organizations and their contacts in the networks, the conversation started flowing and people were saying, I was thinking of doing something with this group, maybe we could do it for Men's Health Week. So what actually happened was some really lovely opportunistic kind of stuff happened, you know, across Men's Health Week that may not have happened if that initial email about reaching out, you know, are you thinking about doing anything for Men's Health Week, wouldn't have come up. And I suppose in terms of the local initiative, you know, we have existing work commitments, and I'm sure no matter where you're working, you have a work plan for the year, you've got KPIs for the year, and I suppose think cleverly. This is, you know, there's a lot of work done for you already in terms of, I suppose, the campaign material, the national support in terms of the communications, etc. So there is potential to weave a lot of this, you know, into your existing work commitments as well. And we do that, for example, through, you know, our commitment to deliver the Engage training. So I suppose when we looked at these initiatives, we just like, who are we targeting? Who are we going to partner with? What are we actually going to do? Where are we going to have it? When are we going to have it? And why is it a viable option? And how are we going to promote it? So very common sense stuff, just like anything when you are any other like event or program that you're planning, these are the questions you do need to ask yourself. So this is a lovely group that met down in Uvan Falls. I think it's kind of near Ballylickey and Bantry in a beautiful part of West Cork. And again, you know, on that particular evening, I was linking with the local diabetes prevention nurse and Cork Sports Partnership, and again a kind of the West Cork Development Partnership, who are one of these, you know, area partnership companies who have brilliant kind of outreach services, who kind of know who needs to be connected in and when and where, and make things at a local level very viable. So I suppose in terms of like the partners, and you know, if it's very consistent across the three presentations that partners, you know, this is key, is establishing strong partnerships. You know, we already have those, or you already have those as well. So it's about kind of, you know, asking the question, you know, that's just a start point, and, you know, being, you know, seeing where there's scope and opportunity. So I suppose some of the partners we would have linked in with there, we're very fortunate to have a community work department here in the HSE in Cork and Kerry. So I think it's quite a unique situation compared to other parts of the HSE. But that's the beauty of like a localized approach, because what we don't have down in Cork and Kerry, it's possible that you have it in Mayo and Galway, or in Roscommon and Leitrim. So that's why I think, you know, both having something national and then more bespoke local things are really, really powerful. We also have, you know, again, the social prescribers, these have been mentioned before, the MARTs, the barbers, the older people services, and the likes of Local Link. So Local Link is a kind of they're responsible for an awful lot of kind of the rural travel schemes and things like that. So they actually, particularly when you look at the geography of both Cork and Kerry, there's towns and villages in Cork and Kerry that are so, I suppose, isolated that, you know, having something like the rural travel scheme and the Local Link is really, really important. So they're a key partner when you're trying to bring those kind of that demographic into events and information sessions and things like that. Where possible, we kind of linked it into existing work, like I said. So that included our Sloan to Care Healthy Communities projects, which are, you know, in the kind of north side of Cork City here as well. Again, the men's sheds, which are, you know, so we did a number of information sessions at men's sheds across the week. The education and training, again, the ETB does such a fabulous array of kind of community courses, and there's brilliant kind of outreach officers. And again, we would have linked in with them around what are the kind of things they could do around during Men's Health Week. The pharmacies, as mentioned, and again, like Cork and Kerry Local Sports Partnership, you know, I'm sure there's a few of you LSPs on the call or on the webinar. You know, their access and reach in all the various parts of the country is fantastic. So to bring them on board, you know, they know every good community venue, they know every good sports pitch, they know, you know, they have tutors, they know who's trained in certain things. So to be able to bring them on board is really, really important. I suppose one thing that we did with Cork LSP, and we found it was really, really good, was that we worked with some healthy clubs. So that's the GA healthy clubs in so there was a number of those in Cork that were already doing work with the sports partnership. And the LSPs deliver a fantastic program called Men on the Move. So some of you may be familiar with that. And Cork at the time were trying to kind of grow the program into kind of new areas. So as part of, I suppose, a kind of identifying new areas, we linked in with some of these local healthy clubs, and we had some health screening and fitness testing go on for men as part of Men's Health Week in these venues. And I suppose for any of the men that were there was an opportunity to kind of for the LSP to kind of say, look, we have this program called Men on the Move. If we thought there was enough interest in the community, we would be open to running it here. And I know that certainly on the back of that, a lot of communities took it on board. And obviously the GA Healthy Clubs would have come on board with providing venues and things like that. So I suppose those existing kind of structures that are out there in communities are really powerful potential to tap into as well. And again, I know the Healthy Ireland coordinators have been mentioned, but we're actually working with local authorities, I suppose, actually in terms of male staff as well. And I suppose some of that work has happened throughout the year. It's not just for Men's Health Week, but again, if you look at the demographic of staff that are working for the councils, and in particular the cohort of outdoor staff, most of them are men. And I suppose most of them would fit into this target of where, you know, they're the type of men we're trying to get into programs but wouldn't be able to reach. So for us, it's been a fantastic experience to be able to support the staff in Cork County Council to kind of in their efforts to improve the well-being of their men. And I suppose one of the things that we are doing around kind of capacity building, because I think capacity building is really important. We have the skills here in health promotion to do things that can build people's capacity around health. So we're actually delivering engaged training to staff in Cork County Council so that they can support male staff around their health and well-being. And that's something that we've planned purposely in the run up to Men's Health Week, because they will be doing things as part of Men's Health Week, and we feel that it kind of gives them, you know, skills and kind of motivation around that. So look, this is just an infographic. I'm conscious of time and I don't want to run over too much. The infographic kind of highlights, you know, an idea of the kind of participation and things like that. It's good to capture that. It's good for ourselves even. But one of the other, and I'll just kind of flick through here, the park runs are there as well. They're on our agenda for this year, and I'm a big believer in park run, and we're actually attending park runs this Saturday for another staff health and wellbeing initiative at Desta 5K. So I can't praise the volunteers and the kind of ethos of park run enough. You know, it really is super. I suppose in terms of the campaign piece, we have a campaigns or communications and I suppose stakeholder engagement team here, and I suppose we've worked with them around, you know, how we can promote what we're doing as best we can, and you know, get our voices out there in mainstream kind of you know, media, etc., etc. So I suppose as part of our media planning, and we've done this last year and we're doing it again this year, you know, we had a template and a schedule for all our social media done. We also had like press releases drafted, and a lot of those I suppose are adapted from the information we've get from the Men's Health Forum anyway. We scheduled radio interviews, and I suppose a number of staff received kind of media training to kind of be confident and competent around doing that. We schedule a number of internal broadcasts, so I know there's not a national HSC broadcast, and also our partners would schedule internal broadcasts as well. And we also made sure that any newsletters we would have Men's Health Week kind of on that as well. So look, this is just to kind of give you an idea. So last year the theme was what's your picture of health? So they were the colors and everything. So we just did look very simple on Canva, you know, this I think it's pretty obvious it's not outsourced, but maybe maybe we can stretch that this year, but get somebody a little bit more professional on board. But these are just done in Canva, and I think they're effective enough. But I suppose we had a number of those on Instagram, Facebook, Twitter, and it was all about kind of consistency. And I suppose our social media engagements across the week were actually really, really good. We had a total of views, and this is just down in Cork and Kerry with a total of views at over 10,000. So we're really, really impressed by that. The national support is really fantastic. It's great that we have the partner packs available on the MHFI website. So I would encourage people to have a look on there, because it's a great start point if you feel I don't know where to begin, because a lot of the stuff will be there for you, even just images and Twitter banners or Twitter handles and all of that. They're all in those. The video that was shown earlier by Collie, that will be there. And obviously the resources such as the Action Man manuals and things like that. And I know that there's also another resource plan for this year, which will be absolutely brilliant to support the team. Just at that part on building capacity, I am an engaged trainer. There's a number of us are engaged trainers down here in the department. So we have planned on purpose over the next 3 months, we're going to be delivering 3 engaged trainings, and it's all kind of targeted at people who, I suppose, are involved in some Men's Health Week initiatives. So the Kerry partners in the Marts, they will be attending the training in Kerry, as well as other partners. In West Cork, again, there's a number of agencies down in West Cork that are a strong appetite to do a lot of work for Men's Health Week. So we're bringing them together for engaged training. And I suppose it creates that momentum, but builds confidence around being able to, step into this line of work as well. And then, as I mentioned, there's kind of a closed training for one of our local authorities, which is, I'm really happy to see that kind of partnership come on board, because I think sometimes when you're wondering what impact you can have, building capacity and having a training like Engage is really powerful to be able to offer. So I'm going to finish, because I think I've gone over time, with no man is an island. And I take that quote from John Donne, but I take it really from Lorcan, who started the day here, because no man is an island. And what I would like people to take from this is that you're not doing this on your own. Whatever you're trying to plan to achieve, all partners, nobody's going to close the door. Anyone we've tried to approach around doing something for Men's Health Week has always responded with, yes, I would love to. So certainly there's lots of support out there. And I would say from anybody, maybe not in the HSE or maybe not in health promotion, to certainly reach out and contact your health promotion departments in the different CHOs, even as a start point to get you on your way. So I'll thank you.
Thank you, Claire. That was lovely. You started with connection and you finished with connection, and I think that's a great call out for everybody in terms of ideas for Men's Health Week. If you're able to create any event or anything that will connect men with their health and well-being, or with other men in a positive way, you're winning, and we're winning in terms of Men's Health Week. You heard the theme. Know your numbers will be. You'll get more information on the literature around that in the coming weeks, but make sure that you're signed up to the Men's Health newsletter. We'll have updates as well from HSE Health and Wellbeing. You can follow us on Twitter. I suppose I called out earlier on that we've had these kind of Men's Health webinars for a few years now, and we have our Men's Health webinars. We've them on our YouTube channel in a few different playlists, and there's some fantastic speakers there if you want to go into a bit of further reading or further listening or watching. In terms of the listening, we have a podcast series, the HSE Talking Health and Wellbeing podcast, and we've had some really inspiring men's health podcasts already last year on that. We've had one actually particularly on the Men's Health Week with Finian Murray and Anne Farrell from CIE, which they kind of give some of the information that you heard today, and Anne kind of shares a lot of the work that they've done in CE in promoting men's health into an organisation, or kind of a set of organisations that have a lot of men in their workforce, just like Claire was talking about there, that they're a target-rich environment, I guess, in terms of men's health. Another one of our episodes we had Dr. Noel Richardson on episode 4 of the podcast, and we've had Men's Sheds on episode 30. So if you want to have a look at them, please do. I really like to thank again all the speakers today, Lorcan, Finian, and Colin at the top of the webinar, and for organising a lot of this stuff in the background. But particularly to Lawrence, Dan, Porrick, and Claire for giving us that kind of deep insight into their work, bringing us kind of behind the scenes into the planning and the delivery and the thinking and the learning and all that stuff. It really, really is rich for anybody working in health and wellbeing or interested in health and wellbeing to see what we're doing, what we're trying to do. And we hope that you'll be able to find a place for your work. And as Claire just said there, don't be afraid to reach out either through the Men's Health Forum or through HSE Health Promotion and Improvement or Health and Wellbeing. It's an open door, and we'd be really interested in hearing about your ideas or find out is there any way we can support you. I'm just looking back here on the Q&A here, seeing, is there anything here? It's got a nice comment there from Chris Ferris from Northern Ireland. Thank you, Chris. I think that's about it. I want to get you out the gate before lunchtime. So thanks everybody for attending, and that's it. I really appreciate it. So take care, and the best of luck to you in your planning for Men's Health Week. Take care.